Hi everyone, so today we will be talking about electromechanical wave imaging. So we are getting interested into electromechanical wave imaging in the scope of guiding cardiac arrhythmias RF ablation. So currently in the clinical routine they use 3D electroanatomical mapping that provides electrical activation maps of the heart. However, this method is limited because it can take a few hours for the clinician to understand the underlying mechanism of the undergoing into these specific arrhythmias and thus to treat the patient. And it offers only information at the surface of the myocardium. What we want to do is to improve the guidance of cardiac arrhythmias treatment by using electromechanical wave imaging that could, for example, be paired with this first method, this time to provide mechanical activation maps of the heart by tracking the local tissue displacement triggered by the heart contraction. So we need high frame rate ultrasound acquisition for that, and this would provide fast activation maps into the tissue thickness this time, and not only at the surface. So for this study, we used an in-vivo model, so 2 open chest swines, on which we screwed pacing electrodes, so to reproduce focal arrhythmias behavior. And we also recorded the local electrical activity of the heart. We used an intracardiac probe that was inserted into the femoral vein up to the right atria with a central frequency of 6 MHz under fluoroscopic guidance. And we performed acquisition at 2,500 frames per second. 8 images were acquired at each time. And for all this acquisition, we performed either during pacing into the imaging plane, so 6 acquisition was performed with a pacing electrode that was into the imaging plane, and 23 were acquired at the same imaging plane, but by pacing the heart from somewhere else. We got interested into this infrandibular region, which is the crossing of the aorta and the pulmonary vein, because it is a known region of arrhythmogenic sources into the right ventricle. So about the data processing, we define a time window of interest, so based on the recorded electrical activity. And for each pair of frames, we computed the interframe displacement using a phase tracking algorithm. And by stacking them together, we obtain such displacement cine loops that allows us to visualize the electromechanical wave front, which is in fact the propagation of the local contraction triggered by the electrical activation of the heart. So this is an example on ex-vivo data we acquired previously. So back to the in-vivo study. This is the cine loops that we obtain by pacing the heart from an electrode which is into the imaging plane. So it is near the orange star, and you see that there is a displacement that could be attributed to the electromechanical wave front, which starts near the pacing site. So that match the pacing electrode location. So when the heart was paced from somewhere else and from an electrode that were not into the imaging plane, we see that the activation pattern of the heart is completely different. So we believe that by analyzing this electromechanical wave imaging, we could guess where from into the heart the cardiac contraction was triggered, and thus in terms identify the arrhythmia sources. So we did not have such clear results for each acquisition because of experimental difficulties, so there is still improvement to be done into the setups. But we believe that electromechanical wave imaging could bring useful information to understand the arrhythmia's behavior and thus improve its treatment. So thank you very much for your attention, and I'll take any questions.